In the first segment today, we discussed artificial intelligence as a cognitive partner. AI can be simply defined as computers mimicking human cognition. But more academically speaking, a complete definition of artificial intelligence is that AI is the development of systems that are endowed with the intellectual processes characteristic of humans, such as the ability to reason, the ability to discover meaning, the ability to generalize from data, as well as to use data to learn from experience. Let's take a moment to look at some specific examples in clinical medicine. We'll start with examples from pathology. One group at Stanford trained AI to more accurately assess prognosis of non-small cell lung cancer from slides compared to pathologists. In two projects at Case Western University, AI was trained to discriminate granulomas from adenocarcinomas on chest-computed tomography with 77.8% accuracy, as well as having 80% accuracy in detection and segmentation of nuclei in breast cancer imaging. The core point here is that pathologists are not being replaced by AI. Instead, AI is helping to scale pathologists' work. Let's look at a second example, where AI is being used to predict patient outcomes. AI is being trained to accurately predict which patients diagnosed with AML will go into remission following treatment for their disease and which will relapse. In psychiatry, AI has been important in analyzing speech patterns to predict the onset of psychosis in high-risk youths with 100% accuracy. A key point to make is that in predicting patient outcomes, AI is not replacing physicians, but instead helping physicians better care for patients. Let's look at some examples where AI might be helpful in primary care. One startup company, Guiant, has an automated chat app for mobile phones that uses AI to diagnose common primary care issues, and only for $10. The patient texts the app their issue, and the app dialogues with them to determine the root cause. Guiant's artificial intelligence chats with the patient using an algorithm and determines a possible diagnosis. The patient then has the opportunity to explore several comparable diagnoses before confirming. The app is fundamentally a two-part process, where, once the AI is done, a primary care provider confirms the diagnosis via text message and offers a treatment plan and/or a sick note. A related example in primary care is how artificial intelligence could be used for patient education. One of the most prominent and recent examples is how Boston Children's Hospital built an AI app on Amazon Alexa called KidsMD. The KidsMD app allows a user to seek general health information for common ailments and medication dosing. It is not meant to replace a physician consult. The key point for both the Guiant example and the KidsMD example is that AI is being used to scale access to primary care. It's helping practitioners work at a higher level of competency and let the so-called low-hanging fruit be handled by the robot. Which of these artificial intelligence examples resonate? Take 20 seconds to write down your impressions, and we'll come back together as a group. Let's come back together and explore some examples in medical education. Since artificial intelligence is so new, the real question is, where does AI fit in medical education? With artificial intelligence being so new, what we need to actually explore is artificial intelligence examples generally in education, as well as some emerging examples in health professions education. Let's start by looking at some examples in general education. One of the more fascinating projects comes from Professor Cynthia Breazeal at Massachusetts Institute of Technology. Here she disguises artificially intelligent robots as fuzzy characters that help preschool and early school children learn to read. But as we all know, reading is only part of the story. The bigger picture in literacy is also being able to tell a story. Dr. Breazeal has created an artificially intelligent listener that has social responses to engage learners to continue to craft and tell stories. Our second example builds on this idea of learner support and moves into the higher education space. At Georgia Tech, Professor Aishak Goel has created an AI teaching assistant called Jill Watson that answers students' questions about the syllabus. IBM's artificially intelligent agent has partnered with Pearson Learning to create a chat-based tutor that uses questions and answers to guide students through a review session. What we see in these examples is that AI in education has been about scaling faculty and creating a cognitive partner for learners. For those familiar with Bloom's taxonomy, the basic approach here is that artificial intelligence allows basic content to be answered by chatbots so that faculty can engage learners in more complex concepts and cases in their constructive time together in class. A similar approach has been taken at the University of Colorado with our VoxScholar.com project, which will be our emerging health professions example number 1. The project is focused on 2 apps, one for faculty development and one for physical therapy anatomy. Both apps allow students and faculty to text or speak to Google Assistant in order to get evidence-based answers for the questions they ask. The Vox Scholar project hasn't just scaled faculty or been a cognitive partner, it's also been about improving access. For our busy clinical faculty, that means getting answers to common faculty development questions right when they need them. And for our students, that means getting evidence-based answers to anatomy even when they can't reach their instructor at 2 in the morning. Our second and final example about artificial intelligence for health professions education is an emerging example in virtual reality. Here, we have ACLS training that is fully voice controlled. That is, you are head of the bed, and there are 6 different avatars that will respond to your voice commands. So across all of these examples, what we're seeing is artificial intelligence is making it possible for scaling faculty, having a cognitive partner for learners, improving access, and making more realistic simulations. In summary, while at the beginning of this presentation we talked about artificial intelligence being defined as computers mimicking human cognition, you can see across these examples that this is only partially true today. While the academic definition of artificial intelligence emphasized characteristics of humans, such as the ability to reason, to discover meaning, to generalize, and to learn from experience, you can see across most clinical examples we're still at the stage of training computers, and most education examples were about cognitive partnership. There's still much work to be done. And now, it's your turn. Please find a new group and answer question 2.